The next question, the member for Guelph.
Thank you, Speaker. I'd like to welcome everyone back. My question is for the Deputy Premier. Public health experts tell us that onerous sick leave policies increase the risk of spreading illness. The province's own public health webpage about the flu explicitly tells people to stay home if they feel ill. And yet the government completely ignored best practices when it cancelled paid sick leave days and gave employers the power to make sick notes mandatory. The rollback of basic workplace protections increased the risk of spreading illnesses to others at a time when we are experiencing a hallway medicine crisis and overcrowding in our hospitals. Speaker, I ask the Deputy Premier, why did the government go against the advice of public health experts by repealing workplace protections that prevent the spread of illness?
Question is to the Deputy Premier and Minister of Health.
Thank you. Well, I thank the member very much for the question. Of course, in every situation where people are feeling unwell, they should be staying home, especially at a time where we have increased concerns and fears with respect to the coronavirus. We want people to make sure that they self-isolate if they're not feeling well. That is really important. And thus far, we have been seeing that happening in the province of Ontario. People are being responsible. They are taking the necessary measures that they need in order to get well themselves, but also to prevent the spread and transmission of whatever illness it is that they have. With respect to the sick leave note issue, that is something that is not mandatory. That is something that employers can choose to bring forward. Many are not doing that, so we anticipate that any issues with respect to that will be mitigated, particularly under the circumstances that we're dealing with the coronavirus by the employers of Ontario.
Thank you. The supplementary question.
Speaker, I ask the Deputy Premier whether she's listening to healthcare workers. 175 healthcare workers recently signed an open letter to the Premier in which they stated, and I quote, "In the context of recent concerns with the novel coronavirus in Ontario, we consider the current provincial labour laws to be a serious threat to the health and safety of Ontarians." Evidence backs this up, Speaker. A poll conducted by Ipsos for the Canadian Medical Association found that 8 in 10 Ontarians said they would likely come into work when ill if their employer required a sick note. The medical professionals are clear. People should stay home when they are sick. So, Speaker, I ask the Deputy Premier, will you listen to healthcare experts and bring back paid sick leave days and put an end to sick notes from employers?
Thank you. Minister to reply.
Well, thank you. Well, first I would reiterate the fact that the sick notes are not mandatory. That is something that can be brought forward by employers. Employers are showing great cooperation and collaboration as we're dealing with the novel coronavirus. We don't want it to spread anymore. So we have been very fortunate so far that we have had only 3 confirmed cases in Ontario. We hope that continues, but that's difficult to say. What I can tell you is the system is working. We are taking the necessary precautions. We are listening to people on the front lines, and we are listening to our public health units. Do we agree with all of the comments that were made in that letter? Some of which we do agree with, some of which we don't agree with, because we know that we are taking the necessary precautions both for the safety of the people who may be affected by the coronavirus, but also for our frontline healthcare workers. We want them to be safe and be able to do their jobs. That is what we're focusing on, and we will continue to focus on that as we deal with this situation. So thank you.